Congenital Heart Defects by Katie Grogan, LPN to BSN student at Indiana State University for the Nurse 444 Community Health Nursing course. Learning objectives. Define the term congenital. Identify the population at risk and the signs and symptoms of heart abnormalities. List different types of major heart defects. Describe the effects of congenital heart defects. Determine potential complications associated with heart defects. Recognize ways that heart defects are diagnosed. List treatment options and corrective procedures for children with heart defects. With a pretest. Question 1. Define the term congenital. Question 2. Which respiratory signs are evident at birth in those with heart defects? Question 3. When does the heart start taking shape and beating in pregnancy? Question 4. Which condition causes a hole in the center of the heart? Question 5. Which two terms define enlarging of the heart and thickening of the heart wall? Question 6. Which complications are associated with congenital heart defects as the infant gets older? Question 7. What condition is the result of an underdeveloped heart? Question 8. Which test can detect a heart defect before an infant is born? Question 9. Which of the following medications help ease the workload of the heart? Question 10. Fill in the blank. Children with heart defects are at a higher risk for infections, either in the lining of the heart or the heart valves, known as blank. The term meaning of a disease or a physical abnormality present from birth is defined as congenital. This population is at risk because being born with a heart abnormality or a deficit increases your chance of medical conditions and certain complications, which will be discussed here. During the first 6 weeks of gestation, the heart begins taking shape and beating, and also the blood vessels begin to form. Signs and symptoms. So these signs and symptoms almost happen immediately after delivery. Sometimes it may be within the first few hours, and in certain cases they may not develop signs and symptoms for a few days in a baby born with a heart deficit. However, almost at all times, you will initially see a pale gray or cyanotic baby, rapid breathing, swelling in the legs, abdomen, or areas around the eyes, shortness of breath during feeding, which leads to poor weight gain. Again, a reason that these babies are part of a population at risk is for those reasons. They have multiple respiratory conditions, poor weight gain. It's going to cause delayed failure to thrive. If you see the baby here, that blue tint around the lips is a classic symptom that they more than likely have a heart condition going on if it is undiagnosed prior to delivery. There are more than 20 major heart deficits, and we'll discuss the main ones here. So to begin with, hypoplastic left heart syndrome, known as HLHS, is a condition in which the left side of the heart did not develop enough to effectively pump enough blood to the body. Epstein's anomaly is when the tricuspid valve doesn't develop properly and blood can flow the wrong way. So even in the heart and throughout the body, you're going to notice the blood flowing improperly in this condition. A septal deficit is an abnormality in the wall, known as the septum of the heart, between the main chambers, and this can either happen on the ventricular or the atrial side. aortic valve stenosis, that thickening of the heart wall. Then you have tetralogy of Fallot, which is a combination of several deficits, including the ventricular septal deficit, a pulmonary valve stenosis, right ventricular hypertrophy, and an overriding aorta. So it is not, the aorta, which is that huge artery, has not developed properly. So all of these conditions are combined, and this is a very ill baby at risk for multiple medical conditions. There can also be holes in the heart. So these holes allow oxygen-poor blood to mix with oxygen-rich blood, and the result is less oxygen is being able to be carried throughout the body. One of the main holes seen is an atrioventricular canal deficit, which is a condition that causes a hole directly in the center of the heart. So effects and complications of congenital heart defects: they have problems with growth and development. They have repeated respiratory infections, infections of the sinus, throat, airway, or lungs, endocarditis, so that infection of the heart, pulmonary hypertension, so the blood pressure is increased in those pulmonary veins and arteries, leading to heart failure and heart infection. So these are conditions and complications that again put this population at risk for developing multiple medical conditions. So how diagnosed? Through a fetal echocardiogram, which they can see some of these heart deficits prior to delivery, an electrocardiogram once the infant is born, catheterization, which can go in and either treat or diagnose depending on what they find during a catheterization, or cardiovascular MRI. Treatment for these conditions: medications, so including ACE inhibitors, angiotensin receptor blockers, beta blockers, diuretics, and antiarrhythmias. All of these medications are given appropriate for the child's weight, and they're helping to decrease the workload of the heart. So with the deficit, the heart is not pumping appropriately, it's not developed the way it should be. So medications are given to decrease that workload and help the heart to function properly. Again, catheterization, they can go in and instead of just diagnosing, being able to treat a condition that they can fix through catheterization. Some of these infants will need heart surgery, and some will even need a human organ transplant. So they would be, if the heart, they are not able to treat it with medications or catheterization or surgery, they will need an organ donation. So they will need a transplant. Post-test questions. Question 1, define the term congenital. C, of a disease or physical abnormality present from birth. Question 2, which respiratory signs are evident at birth? All of the above. Question 3, when does the heart start taking shape and beating in pregnancy? B, 6 weeks. Question 4, which condition causes a hole in the center of the heart? A, atrioventricular canal deficit. Question 5, which two terms define enlarging of the heart and thickening of the heart muscles? A and B, pulmonary and aortic stenosis. Question 6, which complications are associated with congenital heart deficits as the infant gets older? All of the above. Question.